On August 4th, 2020, Beirut experienced a massive explosion that ripped through the entire city. Hours after the explosion, International Medical Corps teams were on the ground to support survivors. Within the first 2 weeks, we reached more than 54,000 women, men, and children. We delivered medical services and psychological first aid through mobile medical units and distributed hygiene kits to survivors to help prevent the spread of disease. We provided medical supplies and personal protective equipment to primary healthcare clinics and hospitals and distributed PPE to more than 2,000 health workers, first responders, and volunteers to help protect them from COVID-19. With more than 1/3 of the city's health facilities and many medical storage facilities heavily damaged, remaining hospitals were overwhelmed and facing shortages of vital medicines and supplies. In response, over the past year, International Medical Corps has provided more than 500,000 health consultations and distributed thousands of hygiene kits to survivors. To support devastated health facilities, we provided medical supplies and equipment, personal protective equipment, infection prevention and control supplies, and medications. International Medical Corps also supported the rehabilitation of 3 primary healthcare clinics, enabling them to reopen and treat patients once again. We reached almost 1,100 people with an innovative COVID-19 home healthcare program for patients with mild and moderate symptoms who were unable to seek care at overcrowded hospitals. International Medical Corps also supported survivors with disabilities who had lost livelihoods and healthcare because of the blast. We provided physiotherapy, occupational therapy, and speech therapy sessions, as well as assistive devices such as hearing aids, glasses, mobility devices, and more. Responding to the long-term trauma caused by the blast, our mental health team provided more than 10,000 in-person and remote mental health consultations. We trained frontline health workers to provide psychosocial support and basic care, and educated local community members about mental health issues and support. And our staff supported survivors with psychological first aid and referrals to higher levels of mental health care when needed. To help displaced women and girls who were at risk of gender-based violence, our team provided information about gender-based violence and support, distributed dignity kits and psychosocial support kits, and provided consultations to prevent and address gender-based violence. With Lebanon facing an economic crisis, we also provided training for women to support income-generating opportunities. With a presence in the country since 2006, International Medical Corps was able to immediately respond to the Beirut blast. And thanks to the support of our generous donors, in the year since the explosion, we have been able to help hundreds of thousands of people and are continuing to serve people in need throughout the country.